Hi, my name is Greg Felt, I'm Director of Public Health in Sheffield. This is a brief situation report. So R is currently between 0.6 and 0.8. The overall case rate is falling, beginning to settle. So the rate of decline is now beginning to settle. I think it'll settle at between 70 and 80 per 100,000 over 7 days. There's still a significant number of cases. In South Yorkshire, there were 1,500 people that tested positive last week, and that was down 500 from the week before, but it's still a significant number of cases. As I say, a slowing of that decline. As we get further into the implementation of the roadmap or unpicking the lockdown, that slowing of decline will probably go to slow further, and it may start to increase. Sheffield has the lowest rate in South Yorkshire. I think we're probably 2 weeks behind the rest of the country in terms of the epidemic curve, and that's largely to do with population and economic structure. But the implication is we will unpick the unlocking at a slightly higher baseline rate. Hospital activity continues to fall in a straight line. Undoubtedly the impact of lockdown, but very, very definitely the impact of vaccination. It's having a spectacular effect, more so than any of us could have actually hoped for, and that's great news. So case rates are falling in the over 60s. There are still some cases in the over 60s, but mild or asymptomatic. The working age population is flat to slightly increasing. They're out and about more. And the school age population is just flat to beginning to increase, and I think that will increase over the next couple of weeks as schools get fully back. Overall, I think the rate will be flat over the whole population into spring and then early summer. So we're into the roadmap. The roadmap is good. The roadmap says we'll cautiously release the restrictions with a stop and check at every point. And you'll underscore the word cautious there. I think as we unpick the lockdown, there will likely be an increase in cases. But remember, that's an increase in cases in a well-vaccinated population. There will still be some cases, however. We're in good shape, South Yorkshire and Sheffield. With a slight caveat that our rates are higher in Sheffield and South Yorkshire than the rest of the country, but we're still in good shape to unpick the lockdown. I'd anticipate some continuation of many of the same basic measures that we've got in place, the same basic public health interventions over quite a long period. Autumn and winter, long time away, but that is a concern. And all of the SAGE post-vaccination scenarios, there will be a further surge. There's no two ways about that. The question is when and how severe. So the B117 variant will find the non-vaccinated people. There's no two ways about that. And if you think it's all over, I'd encourage you to look at what's happening in continental Europe right now. Cases are going up. That happened quick. It flipped really quickly. There are a number of country-specific reasons for that, but it is happening. So the great majority of any further surge will happen in the non-vaccinated, and it is impossible to predict how and when that will play out, but it almost certainly will happen. But for now, we're in good shape, roadmap-wise, and we're in good shape to cautiously and slowly implement the steps out of the lockdown as set out in the roadmap. Long term, I think the virus will be circulating around the world for many years to come. So we will be aiming to continue to balance the clinical harm of the virus in a well-vaccinated population from the wider social harm. And I think we will see some form of adaptation and a low-touch economy combined with vaccination for some time to come. The programme continues to go exceptionally well. Almost 45% of adults have been vaccinated now in Sheffield. So currently, people aged 56 to 59 or cohort 8 are being invited to book their vaccine at a mass vaccination centre such as the Arena. So those receiving the letters are invited to go to the online national booking service to arrange a jab at a time and location that's convenient for them. Or if you can't get online, you can phone 119 free of charge. People aged 50 to 55, the last of the initial 9 priority cohorts, will be invited shortly. The vaccine is having an impact. There's no two ways about that. You can see with the naked eye the impact that the vaccination is having on hospitalisation rates. There's no two ways about that. What was brilliant news from earlier last week was that Public Health Scotland published their data on the transmission of COVID-19 in households of vaccinated compared to non-vaccinated healthcare workers. We've thought that there would be an impact on transmission. This is the first direct data, and it's really, really heartening to see. So all up, the study showed that vaccination reduced infection rates in household contacts by half. That's huge news, and as I say, it underscores what we thought was happening, but we've now got the data to prove it. That will have an impact on transmission rates as well as protecting individuals from severe disease. So if you are invited for a vaccine, please take it, because it protects you, but it also protects others by route of less transmission. So anyone who can't work from home can now get a twice-a-week test at our Asymptomatic test site at the English Institute of Sport on Coleridge Lane. You do need to book an appointment first, and the details are on the website sheffield.gov.uk/coronavirus. What's the point, you might wonder? Well, 1 in 3 of people who have coronavirus don't have any symptoms. They're known as asymptomatic people, and it's possible that they can give the virus unwittingly to others. So by having 2 tests a week, if you don't have symptoms, and self-isolating if you test positive, really importantly, you're helping to protect your family, your friends, your colleagues, and everyone else by stopping spreading the virus. It remains one of the best tools we've got to break the chains of transmission and get back to normal life quicker. If you have to self-isolate, there's support available, including payments of £500, which are now being paid within 24 hours. And again, you can find out about that information on our website, and the address again is sheffield.gov.uk/coronavirus, or call the community helpline, which is 0114 273 4567. Thank you to everyone once again who's getting tested, those who don't have symptoms, and importantly those who do have symptoms. You're all making a massive difference in our continuing fight against COVID. The impact on fertility crops up in my inbox a lot. There is no evidence that either of the vaccines available impact on fertility in any way, shape or form. There's a British Fertility Society statement, there's a Royal College of Obs and Gynae, Royal College of Midwives statement. There's just no evidence. So again, I'd encourage you to kind of look carefully for where you get your sources of info. What we are seeing is that COVID affects fertility. And whilst we know the vaccine reduces the chance of COVID significantly, it's important that you take both sides of the coin into your decision making. So just to be categorical, there is no evidence that either of the vaccines available at the moment has any impact on fertility.